if we're going to talk about tennis elbow, we might as well talk about golfer's elbow. So they're very, very similar, and both are very much overuse injuries diagnosis. And so what I mean by overuse is you're doing a repetitive motion over and over and over again. And what that's doing is that's creating inflammation in and around that joint or in the tendons, causing you pain. Okay? So the technical term is lateral epicondylitis or medial epicondylitis, as in golfer's elbow. And all that is just means it's on the inside or outside, and it's inflamed, and that's it. So the shorthand way of saying it is golfer's elbow and tennis elbow. So golfer's is on the inside, and on the outside you've got tennis. Okay, so all of your extensors, or the muscles that do this, are going to be towards the outside here. All right, so what that means is that these muscles are the ones that are being overworked with your tennis elbow. So if you picture a tennis player hitting like this, a lot of that force is going to go right into the back of the elbow here. So that's why those extensors are overworked. Now, if we're looking at a golfer swing on the inside, so if you're right-handed and you come down, a lot of that force when you hit the ground in the golf ball, it's going to be right here. So it's going to activate these muscles in here. So with golfer's elbow, what we're going to want to do is we're going to want to open these muscles, these tendons up. And with tennis elbow, we're going to want to open these up on the backside. So golfer's forearm, which is flexion, tennis, which is wrist extension on the backside. Okay? Pretty simple. There's a couple easy stretches to do it. Essentially, find a wall, push up against that wall, open those flexor tendons up if we're trying to do something for golfer's elbow, and you're going to do the windmill around the wall or around the follow the clock. Hold it for about 10-15 seconds in each position. Hit it about 5 or 6 times going around. If you want to do it for a tennis elbow, you're going to hit the extensors and stretch the extensors. It's just going to be the opposite. You're going to kind of work your way around and just opening all those muscles up, because there's a lot of little muscles in there. It isn't just one, there's quite a few. Because it is muscles and because it is tendons, you can actually do some self-trigger point therapy where you find those sensitive spots or those muscle bundles, and you can just kind of press on them with your thumb and really kind of knead on it and release or relax those muscles and those muscle knots. If you can't do it on your own, you can do things like maybe a trigger point injection or PRP, or if it's been there long enough and it's chronic enough, then like stem cell injections, that's another option as well. So obviously you don't want to spend all that money and do those things, and you want to do something at home and see if you can't fix it yourself first in the first few weeks. So what I mean by a trigger point is you basically want to so if we're looking at golfer's elbow, you're going to be focusing on this side of your elbow, right? So if you're talking about tennis elbow, you're going to be talking about back here. So you're just going to kind of find those muscles in here and dig around and just find one. When you find it, and you're just going to kind of sit on it, and you're going to go cross on it. So you're going to cross friction, sort of massage it side to side like this, and you're going to glide over that muscle and kind of snap it a little bit. That's okay. And you may be sore when you're doing all this too. That's pretty common. It's especially if you're really beating it up. So if you are, make sure you do ice it. So if you're icing, anytime you ice, 15 minutes on, 15 off, and then you can do that as much as you want. Just take the break. So adjustments. You can adjust. I can adjust elbows. Elbows move fairly easily, but I'm not trying to do it on my own. But essentially, that's all an adjustment is like force into it with a kind of a snap back a little bit. And it's just going to help to reset that elbow joint itself. So it could be, the tendonitis could be complicated from a misaligned joint in the elbow from the ulnar or radius, which connects into your humerus here. So that may be part of the problem, but 9 out of 10, I'd say, 7 out of 10 to 9 out of 10 times, it's mostly going to be the tendonitis from overuse, okay? So the overuse is going to be, the muscles may pull on that bone and try to pull that bone out of alignment, but it's mostly going to be from just fatigue and just buildup of inflammation over time from that overuse. So if you can stop using it so much, take a break. That's going to help you heal quicker. Do that with icing, 15 minutes on, 15 off. Yes, make sure it's adjusted, make sure it's aligned so that it is healing properly in the right alignment. And then if all of that fails, we have a few different types of injections, that are possible. So if you have any questions about any of those injections, leave a comment and I'll shoot